Hello, I'm Varsha Abhishek and I work as a Dietitian and Counsellor for Khushi, IVF and Fertility, JP Nagar, Bangalore, run by Dr. Rashmi Yogesh. Food after embryo transfer is very important. First thing, you need to be extremely cautious, very cautious on what you're eating. Second thing, the pregnant woman should get all the nutrition that is necessary to support the transplant that needs to happen after embryo transplant. So first we give them a list of food items which can have adverse effects. For example, high chances of allergies, inflammations in the body, can cause miscarriages. So these high risk food items are completely cut off. We need to make sure that nutritionally the patient is getting what they require. After cutting down all the risk factor food, we also need to make sure that we tell them to not have anything that is raw, any unpasteurized food, any unpeeled, unwashed food, just to avoid any kind of bacterial infection. Salmonella infection is one of the most common infections. So the hygiene part is extremely important. The milk has to be double pasteurized, the water has to be boiled. So these things have to be considered next. The third thing is constipation is one of the factors that these patients face during their embryo transfer, because most of the time they're advised bed rest and there is no movement, so the bowel movement gets affected. So they have severe constipation. Sometimes even the side effect of the medicines also cause constipation. So we need to take care of that part by including a lot of fluids like soups, buttermilk, citrus fruit juices, and a lot of fiber in the form of porridges, salads, to make sure that the constipation is relieved. Next thing is there are 5 to 6 important nutrients that are very important, and I tell them to include it compulsory every day in the diet. First thing is iron rich food like green leafy vegetables, and there are also some dry fruits which are rich in iron like figs. So because the blood circulation to the uterus is very important during this. And second thing is vitamin C rich food and food with high antioxidants, because immunity also plays a major role. I also tell them not to eat something too sweet or too salty, because the sugar levels and the BP levels need to be maintained. Good hydration is also extremely important. I also tell them to eat walnuts and almonds every day, because omega-3 is very important for supporting this process, and also good quality proteins. For example, at least 2 to 3 egg whites in a day is advised to them. These things, and even sprouts, boiled sprouts every day. Sprouts are packed with nutrition, vitamin C, antioxidant and proteins. These few things which we tell them to include in their diet every day. And other than this, basically go for simple homemade food with less spice and less oil. Nothing frozen, nothing with preservatives, and everything should be heated up well. So this is basically the kind of diet we give after embryo transfer.